Welcome, everyone. This is Rachna, the CEO of the Graduate Student Association at the University of Melbourne. This is Wednesday afternoon, and again, an afternoon session, the ones that we've started because of SWOT-WAC week. I'd like to welcome all those attendees who are listening to us this afternoon, and of course, to all the listeners who will listen to the webinar after the session. So today I'm very, very fortunate to have George Habib, the Associate Director, with us participating in the conversation. He's the Associate Director of Wellbeing Services at the University of Melbourne. So it's wonderful to have a guest speaker once again from Stop One, who have been an amazing partner with GSA during the COVID-19, supporting us with the webinar programs. So before I commence, I'd like to acknowledge and pay my respects to the traditional custodians of the land from where I am broadcasting, the Wurundjeri people of the Kulin Nation, and also pay my respect to past, present, and emerging leaders, and also my respect to the Aboriginal people and the Torres Strait Islanders. In the week of the Refugee Week, as every day, I would be failing in my responsibility if I don't talk about the resilience and the support and the contribution of refugees in our community. And before we start this session, I would like to briefly ensure that as an organization, GSA wholeheartedly welcomes our refugee and asylum seekers into our community and will endeavor to continue to provide support and services to our refugee community with no bias and no discrimination from our organization. So welcome on board, George, and it's wonderful to have you on our Grad Chat program.
Oh, thank you very much. Thank you very much.
So,
go on.
George, I understand you've been in the role since March 2020, and I thought I may just spend a couple of minutes to talk a little bit about you and read a short bio about you. So George is a clinical psychologist, and, you know, as I said before, he is the Associate Director of Wellbeing Services at the University of Melbourne, and an interesting time that he joined the university in March 2020, a time when the service headed by you is most wanted and used by our graduate and student community. So George he has been an honorary lecturer at the School of Clinical Services at the Monash University. He has been a Deputy Director of Psychology at Monash Health. And he is a part of the Psychological and Specialist Services design team that implemented a number of clinical programs focused on access to psychotherapies in public health services. And interestingly, George has a great passion and has continued to provide clinical leadership roles in government, health, and NGO. And he's the currently non-executive board member at Victoria Legal Aid and the chair of the VLA Workplace Wellbeing and Health Safety Committee. So he's also a member of the Monash Care Steering Committee that drove an organization-wide approach to the social and emotional well-being of health professional staff. So he provides training on psychotherapy, workplace well-being, and is a trained psychological first aider and critical incident responder. George, what an amazing achievement and a career, progression that you've had. So we welcome you into the University of Melbourne's services. And we wanted to just ask you a little bit about yourself and interestingly enough, the time period that you've joined in your role. So talk us through that.
Yeah, look, it was, thank you, Rachna, and for the very generous introduction. I mean, I always think that when you listen to yourself on paper, you're much more impressive than what you are in person. But anyway, outside of my slight awkwardness at that intro, look, it was a really, really interesting time to join the university. I've lectured in university environments and had teaching roles for a long period of time, but I haven't really worked in a kind of operational role within a university. And here I was coming on board when suddenly 2 weeks after I started, we're having to move into being a virtual community largely. There were some exceptions because the programs that I run also include the health service, and the health service has continued to operate with face-to-face service delivery and service provision. But it was a really interesting time, just like, you know, the academic faculties, just like graduate students are having to kind of adjust and come to terms with what does it look like to be learning remotely. We had to really do what I would say probably 2 years worth of work in about 2 weeks. You know, just in terms of, you know, getting us to be able to kind of deliver our programs and our services online. In terms of the services that I'm responsible, so I fit within student and scholarly services. You're right to talk about my office is at 757, which is where Stop One is. And the programs that I'm responsible for is the health service, the counselling and psychological services, better known as CAPS, student equity and disability services, which have had an incredibly large part to play over the last few months and currently during examination period with technical kind of considerations if people are dropping out from when they're sitting exams and their tech doesn't work, and also the chaplaincy service. And so we had to kind of move all those services online. The health service needed to gear up for the pandemic. And so we introduced a COVID testing service, a hotline, and we recruited to an infectious disease coordinator who's going to be helping the university. It starts to transition over the coming weeks, months, and maybe years to being both an online and also a campus delivery of services.
Fantastic. George, I may at this moment, so that, you know, students who are listening to the program and who may be international students and unfortunately have not had been able to make an entry to the country, just unravel these services a little more. So when we talk about the health services that are under your program, can you just briefly tell us a little bit in an overview of the health services and who can access that?
Yeah, so the health service is both for staff and students of the university. It's not, they're not accessible to community members, but just for people who actually are either employed by the university or studying at the university. And the services that we have there is we have general practitioners, we have psychiatrists, we have nurses and mental health nurses, and we have psychologists, predominantly clinical psychologists who work there. And yeah, providing the suite of what you would expect in a kind of a general practice, really.
Sure. And it is it a free service to the community and for people who hold a Medicare card only, or for international students?
Yeah, it is. Obviously through their insurer, like our preferred provider at the university is Bupa, and when you're insured under that as an international student, you have access to the service, and domestic students are able to access it as well. It's entirely a bulk billed kind of clinic, so there's no out-of-pocket expenses. We've worked very hard to kind of maintain it as such. And so, yes, whether you're international student and insured, obviously the biggest issue, if international students are stranded at the moment or studying still from their country of origin, they're not able to access GP services through the health service because of, you know, all the various Medicare and, health insurance requirements for doctors.
Yeah, fantastic. So, I mean, it's a good service for people who are near the campus or who start coming back to the campus to understand, if you're fairly new to the university, there's an important medical service that the that the University of Melbourne provides as a part of their wellbeing support strategy.
Absolutely, and all the doctors and all the professionals can also see people via teleconferencing now. So we've set up now to be both online as well as face-to-face clinic, and it operates out of Cardigan Street in Parkville.
Yeah, and I think it's something that I remember talking to Professor Steve Trumbull from the university, ensuring our student community are looking after their other health issues rather than also only the COVID-19 related issues. That, he said that he'd encourage people to just go to your general practitioner or take a telehealth appointment if you have health issues that you've not been, working on over the last period of time. So I think that's a fantastic service that student community and staff working at the university should be able to access. So we have spoken a little while ago about the CAP services, and the counseling and psychological service is critically important. And you, as a very trained clinical psychologist, would you be able to kind of highlight to the students of accessing counseling, and particularly during this time, why it's important from your as a trained professional?
Yeah, well, one of the real benefits of that service is that it's really been focused on helping students at the university be able to deal with whatever's been going on in terms of stress and distress, and it's not just a service for people who may have a more kind of recognised mental health issue like an anxiety or a major depressive illness. Yeah, so it's really been set up recognising, as with what we know in terms of our research around university students, that there's a higher level of kind of distress through the way we suspect due to just being a university student, and so this the service really is very easily accessible. It's available both. It's just a telehealth service, so it's doing all its appointments via telehealth. Very, very easy to kind of book into, and it offers a whole range of different services. So yes, it has a traditional kind of individual counselling approach, but it also has a bunch of online resources, including on our virtual communities on the CAPS website. It's got a COVID-19 tip sheet and information about how to manage. It's been utilised. I think over the last couple of months, it's had more than 40,000 people who have actually clicked on it. And what's really interesting is that students have been staying on the site for more than, I think, 7 to 10 minutes. So that's pretty unusual for a web page to have that level of kind of involvement. And the other thing is we've got a whole bunch of programs online. So that includes with international students, with UMSU International, there's a range of programs to be able to deal with kind of adjusting to studying at the university. If you've come from overseas and you're currently in Australia, how you manage kind of getting to know people, dealing with adjustment difficulties. And there's a whole range of webinars and group programs to be able to deal with things like if you're finding it procrastinating or finding it difficult to kind of relax and feeling stressed. There's a whole range of programs around helping you with relaxation, mindfulness, and they've been really, really utilised much more extensively, to the point now that we know that we want to be able to keep both an online program going, even if we go back to seeing people face to face.
Fantastic. And I think you were mentioned briefly about when we were having, GSA was having discussions with you about the after hours service that you as a new director has kind of negotiated to commence. And would you be able to give us some more details about that?
Yeah, look, we're really excited about this, and I'm really resting on the shoulders of giants around this one, Rachna, because I know that my manager of the counselling and psychological services has been wanting to get this after hours mental health crisis support program up and running for a couple of years. We just got the opportunity, given that we knew that the challenges of COVID-19, that we needed to think about ourselves as a service that didn't just run during, daylight hours. And so we've partnered up with a very credible organisation. So some of your audience would know about Lifeline. It's a heavily promoted telephone support service that runs within Australia, and we've been able to partner up with them to be able to kind of make sure that students are able to contact that service after hours and to seek mental health crisis support. And that depending on what the issues are, it might be that the issue can be resolved with the phone call or the text that happens and the chat that happens between the services, but all the calls then are followed up by our counselling service the next day to see whether they need to see someone from CAPS or whether they need to be given a warm referral to other areas. So, for example, for financial support, if they're experiencing some troubles around their academic learning, whether we refer them to our academic skills area. So it's aimed to really be so that we're now a 24/7 service. And we're hoping that that's going to be all going well. And I think it's tracking reasonably well. It's going to be up and running in early July.
That is such a fantastic service. And I think for understanding that, the University of Melbourne doesn't consider well-being of students just when you are at the campus, or, it is about providing a holistic services and understanding there are factors that impact your student life, and the importance of offering these counseling services and additional services is to look at holistic package and understanding that the university is there to support students through their whole student life and ensure their community is a part of, their own well-being strategy. So I think it's a very well, needed services, and congratulations on help, getting it moving quite quickly under these adverse conditions, and particularly for the fantastic support we receive from CAPS and your staff at your center. I think sometimes the more, I haven't been here too very long, George, but I think when I talk to our students, people have a limited understanding of the chaplaincy service. And I wondered whether, it's something that we don't tend to kind of think about, and its importance in your view of as a director who oversees that program. Would you like to share your views with our listeners?
Yeah, absolutely. And well, I mean, the point that I would make is that I'm very strongly of the view that well-being dimensions of people's life, or even potentially if we even think well-being on a dimension to then maybe say mental health issues, that actually we know that those issues can be attended to by a number of different people. So for example, we know that someone's mental health can improve if they're under less financial stress. We know that people can feel better about themselves when they've got secure housing. Chaplaincy is one of those, or our kind of our pastoral care that chaplaincy offers is that we have a range of denominations from Anglican, Catholics. We've got an imam who's available, and also a rabbi, they give their time to our student groups. And so what we've known with the chaplaincy service around what you've actually spoken about is that often people don't even actually know that it's an available service within the university. So we're doing a lot of things at the moment to increase its profile so that students know that students of faith know that they've got a place to be able to connect. And we know that spiritual or religious connection is one of the really strong resilience factors for people in being able to deal with adverse times like we're experiencing during the pandemic. And so we're currently modernising the web page for our chaplaincy service. We're meeting every fortnight. I meet fortnightly with all the chaplains to be able to kind of improve the how to be able to access them. And we've just set up for a couple of the chaplains, not all of them because of their availability. Also, they're always able to be contacted by phone, and on the website they're available. Their numbers are available and their way to access. But we're also, with some of our chaplains, setting up a booking system through Stop One, so that it becomes easier to actually just book in an appointment for the chaplain to be able to come back to you. I guess my perspective, Rachna, is that I kind of think that healing, or being able to kind of care for yourself, it's not just the domain of people going to see psychologists. Yep, that it can happen in many different touch points within the university, and chaplaincy is one of those, especially for those whose faith is incredibly a place of solace for them.
Oh, that's so beautiful to hear, George, because I think it's a very important message in the current moment that some of our students have openly expressed to us, the perception of inclusiveness and the importance of accepting differences is one of the key aspects of this healing process, so that issues of racial discrimination, the fear of difference is something that we as a community have to work together. And I think, as you have rightly said, that different mechanisms are there for different faiths, beliefs, thoughts, processes are there. And I think I remember going to Stop One and meeting the manager who runs this chaplaincy service, and thought for a moment, I had never given that a thought, and that having listened to her, the understanding and its importance, that I felt at this program, it's very important to share that information, because I think it's one of the importance of Stop One, which says really clearly is we acknowledge the difference and diversity, and the programs are kind of extended to cater to different people's needs as much as possible. So I probably wanted to talk a little bit about currently at the moment. As you would appreciate, our students have gone through a period of 12 weeks of being socially isolated at our different places, wherever we are living, being with our family, or, in our apartments or houses, or with your partner. And you've come to a point where some of us moved from face-to-face to online, or some of us have missed our friends and having group discussions, and we're now in an exam period that is there. And I guess, we've been very, very fortunate to have the academic support staff coming and sharing tips about how to prepare for exam. But from an associate director perspective, what would be the message that you would want to give our students, and encouraging them to use support services during this period, particularly to deal with academic support?
Well, the first thing that I want to say is that we've got so much support available at the university, including around being able to help people with their academic stress. But what we know, and this is hopefully part of helping to improve this, is that the students actually knowing what we have available is one of the biggest challenges. And so just recently, it hasn't been published yet, but there was a report done between the medical faculty and Bupa, a huge survey that was done with Melbourne University students. We surveyed about 27% of the student population, which is a very high percentage in terms of a survey a couple of years ago. And what it showed was that that students' understandings of what's available and how they can actually seek support through student services, not through, of course, their academic staff, but also through student services, sometimes can be limited. But we have in student and scholarly services, we've got academic skills division, we've got student involvement divisions and programs which really work with students around if they're struggling with, you know, a particular study, being able to kind of access. I don't want to also take away that we've also got a really extensive program within student equity around if people are really struggling with their learning, being able to look at applying for adjustments. So not just special consideration, that's often known, that process, but also being able to have a process in place if people, for whatever reason, you know, whether they've, you know, for example, you know, the amount of adjustments we make for people who might be on the autism spectrum, other people who've got other difficulties, whether physical or mental health difficulties, which may be impacting on them, that we can actually do significant adjustments to help them actually succeed in their studies. And so what I'd say is, if you're finding it difficult, you don't need to work it all out on your own. Yep, that there are both, you know, informal supports and more formal supports, and that you should utilise the resources that are there within the university.
Absolutely. And I think that, you know, asking for reasonable adjustments based on individuals' health needs or special needs, or, you know, having that communication actually gives you a positive experience of your journey in relation to education, because you're not struggling, but you're actually enjoying the learning and assimilate the learning constructively. Because I think most of us who come to do postgraduate education make a conscious decision to take that path, and it should be something that you you know, relish and you enjoy, and you are maximizing that opportunity. And I think often it is important to acknowledge, George, that sometimes particularly in when we have come from different countries or different perspectives, that disability is seen as a taboo. In fact, I think the way the university approaches it is being able to offer that additional learning support in order to, you know, achieve your academic excellence, is what you're kind of highlighting to, which is an important thing for students to access as a part of their journey in education. So, George, it seems it would be very right for me to ask you, I understand it was 2 weeks you were into the job, and then you find yourself in isolating, navigating the whole kingdom of the university pretty much through the Zoom. How has that relationship been with technology and a new work regime for you?
Yeah, look, I mean, look, I'm a little bit fortunate because I have the health service has still been operational. I've still been going in and working from there a couple of days a week, and not that I've had to do that, but it's definitely it's been my preference. For me personally, working 5 days at home doesn't work entirely well for me.
Yes.
And so I've had some opportunity to be able to break that up. Look, what I would say, and I was speaking to my teams a little while ago, and I know that people have been, you know, have taken this on really well out of necessity, but have accepted that this is what's been required to be done. And everyone was in a frantic kind of space to kind of set themselves up to be able to continue to learn or work virtually. But generally speaking, that's been, you know, I think that now is where we're starting to see that this is not something that's just short term. Yep, and we know, you know, so for myself, like I've definitely been thinking, I know early on when I was working from home, I was forgetting to kind of get up and go for a walk around the block like I would often do incidental exercise when I'm walking around the campus. Yeah, so I'd go to meetings, and by the end of the day, I would have done 5 kilometres of walking. Well, if you're working from home, you don't do that. You have to do it purposely, not incidentally. And so I've kind of, even though I preach very much about well-being, I found myself having to work very hard to kind of make sure that I'm adapting to this new environment. And the really basic things around structuring your time. I get dressed for work, even though I could be in my tracksuit for the whole day. I make sure at the end of the day I switch off my computer. I've had to put in a whole range of things to be able to separate home from work. And I think that's a really important thing for people to think about in whichever guise they're in, because I think otherwise every day seems to blend into the other if you don't structure those things up.
Yeah. And I think it's such a good message. And thank you for reminding us all. And as you know, stop one is the services that George has oversight on. It's a service that is for the staff and the students. And I think we forget that if as staff members, if we're not good to ourselves, we're not going to be good to others. And I think, it's something I think I'd encourage our GSA staff who are listening to the program is being mindful is nothing as urgent, but have your lunch breaks and taking those time for exercising. I think it's been a very good reminder to me too, George. I think a couple of weeks when you're too busy with things, you always find an excuse, but you actually really have to look after your mental health and well-being. So
I think so because we're running a marathon. Really, it's not as much as we might have hoped that it was going to be short term. This is going to stretch on for a period of time, and we've got to put in structures and processes in place to make it sustainable.
Fantastic. And George, on behalf of everyone at GSA, we congratulate you on your new role, and we really look forward to working with you and your team alongside on the Wellbeing and Support Services. I think the brief interaction we've had with you itself, it's so encouraging to see your vision and the new services that you're thinking of, and particularly the after-hours service is something I think your team has worked constantly and advocated for the program to commence, and it's wonderful to see it that it'll be taking or launching off very soon. So we thank you for your time, and good luck and we hope to definitely see you in person very soon.
Oh, I'm really looking forward to working with you and GSA over the coming weeks and months and years.
Thank you so much, George.
No worries. Thank you very much.
So moving on, I think it was such an important session for us to hear from George about George Habib, the Associate Director of Wellbeing Services at the University of Melbourne, to hear about the services Top One offers. But I thought it's also an exciting time for GSA to talk a little bit about a grant that we've been successful through the SAFF funding program. So the Student Services Assistance Fund through the University of Melbourne every year advertises for small funding grants that are made available to student associations and other organizations. And we have GSA this year, based on the recommendations that we have received from a range of our providers and our students, wanted to ensure that international students who have limited English language skills are able to are able to access culturally appropriate bilingual counseling services at the University of Melbourne. So the CAPS offers a range of fantastic services and culturally appropriate services, but we found through research and as well as our conversation with international students that these services, counseling services particularly, are not accessed a lot by international students. So the project is really working over the next 12 months with our different stakeholders in ensuring that, GSA, the UMSU International, working with a range of other service providers to ensure that we discuss with international students, be able to have some focus groups initially to identify what do international students understand by what counseling services are offered in Australia, to understand the nature of the program, the benefits of the program, and what their understanding of it is, and then being able to identify some of the barriers that prevent them from accessing the services. We also want to ensure that the promotional material that are provided about counseling services are meeting the needs of our student cohort who have limited English language skills in understanding complex medical or non-medical terms, and the importance of how international students can use interpreting services or bilingual counselors to access appropriate counseling services. We also want during this project in the next 12 months to promote the importance of taking care of mental health and well-being, which will be absolutely critical for us when we all return back to our campus or try to have a kind of normalcy that we would have post-COVID-19. So we are thrilled that we have been supported by a small funding of $20,000, and that would be supported by GSA with an investment of our own reserves that we will be injecting into this project to ensure that the counseling services will be extensively used by international students, and where required that the students have the option to ask for a bilingual service who may be from CAPS, from the Counseling and Psychological Services, or relevant other organizations who have the expertise in that area. So we look forward to working with the international students cohort, as well as AMSU International and CISA, the CAPA services providing us guidance, and the Stop One's counseling and psychological service to design the project and implement the project over the next 12 months. It is Wednesday, and as we all know, that I would encourage students who are preparing for their exams, that to understand that you do take some time off from your studies and ensure that you are looking after your health and well-being, and that if you require any additional exam support, or if you require support from your peers, to pick up the phone or to reach out via email, because trying to deal with issues in isolation and without the support of your community and friends in the campus can be very difficult. And please jump on to GSA's website, where there is a range of social activities also advertised. It's free of cost. It's wonderful for you to be a part of a group that has common interest. And please feel free to kind of listen to our webinars whenever you have a free time and provide us the feedback, because all these sessions are put in place to support you through this difficult period of the exams. But also I know that the student engagement team also have the coffee cart, which is now in a new form, where you can access your free coffee from the cafes around around the university or suburbs around the university. And we have outlets from different points of different suburbs. So I think overall, GSA wants to acknowledge that this month is going to be particularly difficult for a couple of students who may find the challenge of exam and online exam quite challenging. And I think the best way of dealing with it is seeking the relevant support and being able to talk to people who can assist you to address your issues. So it's goodbye from me here, Rachna, on Wednesday afternoon, and we look forward to you joining us for academic support tomorrow afternoon, Thursday at 3 p.m. Thank you.